Good afternoon. Welcome to this Tuesday afternoon press briefing. This will be our last press briefing until we switch into our new mode starting on Thursday. So we won't have a press briefing tomorrow, obviously, and then we'll start on the new sequence of Thursdays and Mondays at 3:30 in the afternoon. Today's press briefing will cover hospital updates. We are clearly now experiencing what the medical professionals are calling the surge. We're starting to see those numbers increase here across the state of Iowa, and so a lot of that focus will be on the discussion today. So as always, we will start off by introducing you to the Emergency Operations Center Incident Commander and the Director of the Health Department here in Glascock County, Dr. Nafissa Cisse-Egbounye.
Good afternoon. As of today at 3:30 p.m., we have confirmed an additional case in Glascock County. We cannot tie this case to a specific exposure. The individual is not sure how or where they became infected. And because of not being able to identify this exposure, we are considering this to be community spread. Our guidelines, however, do not change with this information. Individuals 60 years of age and older with underlying conditions should stay at home and avoid gatherings or other situations of potential exposure. Please limit travel outside of Iowa or affected areas. Practice social distancing. Wash your hands frequently for 20 seconds. Don't touch your face, nose, and mouth, and cover your cough or sneeze with a tissue. Remember, no group gathering of more than 10 people, and even with the group gathering of 10 people or less, you have to practice social distancing, which is 6 feet apart, meaning as distance as the length of a full-size mattress, a long dining room table, a standard 3-seat sofa, or 13 iPhones end to end. I want to thank the Health Department staff who continue to work in providing the essential services. We are still seeing patients by appointments for treatment and high priority case follow-up for sexually transmitted diseases. With that being said, please continue to practice safe sex during this COVID-19 crisis. We know that social distancing can feel lonely. However, our testing services are limited at the moment. We need people to practice and take social distancing very seriously. And again, I repeat, that's 6 feet apart, meaning 9 containers of disinfectant wipes end to end. We want to thank everybody who has donated a handmade mask and those who are in the process of donating. Thank you. A press release will be sent out tomorrow morning with IDPH's guidelines on how the masks should be sewn. I want to thank you all for continuing to listen to us. I know that we can sound redundant. However, this is what really is going to help us get through this pandemic. I want to thank all our partners for their persistent work. This is a time as a community for us to be very proud of each other and our local organizations. Sheriff Thompson, thank you for your support and your dedication to always ensuring that our Emergency Operations Center is being run smoothly and efficiently. Thank you.
So you'll note that on the COVID-19 Glascock.com website that we have moved to a moderate position. Now that we've reached that community spread plateau, one of the factors that cause us to urge you to pay attention to us and be vigilant when we say, hey, we may need to call you in, that plateau or that pinnacle has now been reached. We will no longer be concerned about the first case of community spread. In fact, you'll probably not hear us talk too much more about community spread at this point, now that community spread is a reality in Glascock County. The fact that community spread is now a reality, we've been preaching and encouraging best practices and safe practices from the very beginning as though it existed all along, because as you know, the testing being such that it is, as well as the concerns being such that it is with this COVID-19 virus, we've been trying to encourage the public to function as though community spread was a reality from the very beginning. There is a large section of the community and our population that has taken that very seriously, and we're greatly appreciative of the fact that they have. However, I think that there is still a segment of the population that is very, very naive to the fact that, or the assertion that this can't happen to me. And the unfortunate reality, and I think we're going to find this very quickly now that we may be into this surge period, that within the next 2 to 3 weeks, I think you're going to be pretty hard-pressed to find somebody that has not been personally impacted, either knowing someone or having personally been impacted yourself by an affliction with the COVID-19 virus. So from a law enforcement perspective, as well as from an emergency operations center's perspective, now more than ever, when we tell you that we need you to socially isolate and socially distance, when we tell you that we need you to take an investment, a personal investment in yourself and in your family, we're not doing that because this is a me environment anymore. We're telling you that because this is a we environment. Everybody that you come in contact with potentially puts you at greater risk, puts your family at greater risk. That investment is critical. So think about we, not me. It's too easy to get yourself caught up in this very narrowed focus about the things that personally affect you every single day. And right now, what we're trying to do is protect the population of Glascock County and, quite frankly, the state of Iowa. And thankfully, in Glascock County, we're still sitting at 7 people. But I think the next plateau that gets reached is when we have that first death. And we're working arduously to try and prevent that number from ever being tipped on the scale. So that's what we need help with. So with that, our first briefer of the day is the Chief Medical Officer for MercyOne, Dr. Matthew Sojka.
Good afternoon. As Sheriff was talking about the surge, we are constantly planning for that, especially over the last 5-7 days as we're seeing the numbers grow in Iowa. And in that surge planning, at least at MercyOne, we're trying to be ready for that if it ever comes. Our ICU capability will be able to increase 250% over our standard numbers. Our inpatient numbers on the Waterloo campus will be 200%. Our Cedar Falls campus will not have the ICU. We'll move all those beds over to Waterloo, but we will still use that for regular cares and even COVID positive patients as we try to take care of them, as we try to serve the communities. Part of what we've done then is by having no elective cases, we've developed a labor pool of nurses and staff that are available, and we're cross-training them into intensive care medicine, inpatient medicine, even to assist in the ERs if need be, so that we are ready when the surge does come. Another thing that we're doing is our respiratory clinic. We've talked a little bit about that in the past. We are going to be starting that as of tomorrow. If you are a MercyOne patient, all you need to do is call your provider. You will go through a triage process to see if you deserve testing or if that's where you need to go. And then you'll be scheduled an appointment at the respiratory clinic. If you are not a MercyOne patient but would like to be seen, we have a number, 272-CARE. Again, 272-CARE. And you call that number. Again, you'll be triaged, and if you meet the criteria for the respiratory clinic, we will send you that direction. The respiratory clinic is at Ridgeway and Kimball in the old Schoitz Hospital. It'll be there, but it is by appointment only, 1 noon to 5 p.m., Monday through Friday. And that will be starting tomorrow. So we're very excited about that. And the reason to have this is to keep patients out of our primary care offices, to keep patients out of our urgent cares if they have COVID. Really, that's going to be our main site to test. And that's our goal as we move forward. Also, our virtual visits. We've got those started last week, and they're going gangbusters. Most of our primary care providers have those developed, just notify your primary care provider that that's what you want, that you want an appointment there, and they'll take care of that. And we continue to grow those numbers as we move forward. I want to agree so much with Sheriff Thompson. The community's done a great job in preventing COVID. 7 cases when smaller counties, Dubuque, Washington, Muscatine, I have connections in all of those. Much smaller counties, much higher numbers. But we need to keep our vigilance. We need to keep our social distancing. We need to stay home. So again, I encourage that. Thank you so much for everything you've done.
Our next presenter is the Vice President and Medical Director of the UnityPoint Clinic Systems, Dr. Dan Glascock.
Good morning, everybody. I just want to touch on one thing really quick. You know, we've already discussed that we've reached the moderate level here, and what that means is that we are starting to see community spread. But keep in mind that we are not supposed to see our peak until about 3 weeks from now. So we are only getting started on this, and this is the time to really double down and really be more vigilant about our social distancing, our hand washing, our all the things that we're doing to really try to take care of ourselves. So. You know, there's lots of things that UnityPoint Clinic and UnityPoint Health are doing, very similar to what MercyOne is doing. It makes me feel like we must be on the right track if we came to the same conclusions and for things that we need to do to try to limit community spread. One of the things that we are doing in our clinic is that we are starting to limit seeing patients only for essential visits only. So we are rescheduling the well visits. We're rescheduling follow-up visits on chronic stable problems so that we can keep people at home, keep people out of our waiting rooms. And we certainly appreciate our patients understanding that this is to keep them healthy and limit the spread of the disease in our community. We've developed similar platforms to what Dr. Sojka mentioned. We've been doing phone call visits for a little over a week now. That's been going quite well. Patients have been very receptive to that and appreciative of the fact that we're keeping them out of harm's way by allowing them to stay at home and still deliver care to them over the phone. We've had several of our providers that have been doing virtual urgent care, and I think that's been a great platform for people to be able to get urgent care needs met without having to actually go to an urgent care center and sit in a waiting room where there may be potentially ill people near them. And in the very near future, we're also going to start our virtual scheduled care platform. And we're going to start with our most highest risk patients. Those are going to be our patients that go to our diabetes and endocrinology clinic, our internal medicine clinics, and our oncology clinics. And as time goes on, we'll hopefully be able to extend that into other clinic settings as well. But there you can get your full care through a virtual visit and see your provider on the screen, and I think that people will really feel like that's a benefit to them. So I think a lot of these things that we are doing are really directed at trying to keep patients safe, first of all, but secondly, we're also trying to free up providers and staff so that we can start flexing them into areas of need. You know, we know that we're going to have a lot of patients in the hospital that have COVID-19, and because of that, we're going to see a lot of healthcare workers, nurses, and patient service representatives, and physicians, and providers of all sorts that are going to be exposed to this, and they are going to get sick as well. So we need to have a backup plan to fill in for those people when the time comes. So. Another thing that we're doing very similar to MercyOne is our dedicated respiratory clinic. We have in our region we have 6 urgent cares, but the one that's on Ridgeway at United Medical Park, that is our dedicated respiratory clinic, and that is open 8 a.m. to 8 p.m. 7 days a week. And that is really meant for anybody that is coming in with respiratory type symptoms. So they are encouraged to call ahead, and they will go through the screening questions that everybody goes through to see if they qualify for COVID-19 testing and to see whether or not they really should come in to be tested. So that number for that clinic, and anybody is welcome to call, is 833-5888. And of course, we are also developing our surge plan for Allen Hospital. That starts in our emergency room. I think last week we talked a little bit about the tent that we have put outside, and we'll be doing triage in that tent. And so anybody that comes in with respiratory symptoms will start there. We have not done that yet because we haven't really started to see the big influx of people, but we assume that that's going to happen in the very near future. So if you have any respiratory symptoms but are not severely ill, you will stay in that tent for your entire care. You'll receive medical screening exam. You will get the COVID-19 testing if you meet criteria. And I think we need to make sure that we understand that there are criteria that we are following. So that's non-discriminatory. Whatever your age, your sex, your race, your gender, if you qualify for the testing, then you will get the testing done right there in the tent. And then you will be given appropriate home care advice and be discharged. Patients that present more acutely with fever or respiratory symptoms and are more ill, they will be evaluated inside in 2 Heart, which is one of our floors right above our emergency department, and that will be our dedicated ER overflow for patients with respiratory symptoms. And then if you are presenting to the emergency room with problems other than respiratory symptoms, your chest pains and that type of thing, you will go to the emergency department just like you always have. We'll also have a dedicated respiratory unit, which will house all of our non-critical respiratory patients. That may be while awaiting results on COVID testing or that type of thing, or patients that are COVID positive. So they will be placed on contact and droplet precautions, and if there are any aerosol generating procedures, then our staff will be wearing additional protective equipment such as the N95 masks. Because we're really trying to conserve our PPE. We know that there are likely to be some shortages of those things as time goes on. And finally, we have our intensive care unit. Allen Hospital usually has 12 beds dedicated to the intensive care unit, but our surge plan more than doubles our capacity to care for those critically ill patients that require a ventilator, and we have about 34 ventilators in total. So in total, between Allen Memorial Hospital and Marshalltown, our surge planning can accommodate an additional about 120 beds to meet the needs of our patients. So these are the things that we are doing at UnityPoint Clinic and UnityPoint Health to try to address the needs that we'll have as we see the surge develop. Thank you very much.
Our next briefer is the medical director at People's Community Health Clinic here in Waterloo, Dr. Sharon Duclos.
So I just kind of want to reiterate what UnityPoint and MercyOne has talked about. The same for People's Clinic as far as what we're doing in our clinic. We're definitely following the social distance, separating our well people from sick people, canceling those well visits when we don't need them. For younger kids, and especially those first few years, you got to keep doing the well visits. Those immunizations are very important. So then trying to make sure that you're keeping them well as you have them come in. Working on virtual visits also. So the good news is our community is so united in doing all that to help people in the Black Hawk County. So that's number one. Number two, we are also following the criteria when we see sick people as far as testing for the COVID disease. And there are criteria out there, and we're all following it for a reason. This is what we know, and we found out very quickly about the COVID infection, is that it does not care where you live, who you are, how much money you have, how much money you don't have, big, little, otherwise. It just likes to infect people. Anybody that little virus can get its hands on, that little virus is happy. So doesn't matter the color of your skin. If you meet that criteria, we are going to test you, okay? But more importantly, if you have respiratory symptoms, if you are ill, we are going to help you. We're going to help you. We're going to help you try to decipher this and help you the best way we can to keep you healthy and to get you back on your feet. Had somebody in the office today say, I don't understand what our role is. We don't have respirators. What's our role at People's Clinic? So look at the numbers and look at the percentage of people who require intensive care help. So the percentage of people who require intensive care help is really low. Our goal is about everybody else. And our goal is also taking care of all those other needs. So if I can keep my diabetic out of the emergency room and not in DKA because they're taking their insulin and we keep their sugar under control, that's a win. That's a win for somebody else who is ill. The same for my hypertensive patients, that they take their high blood pressure medicine so they're not having a stroke or a heart attack. Congestive heart failure, if I can keep somebody out of heart failure and they don't have to go to the emergency room, that's another win for our community. So for primary care, that is huge. Separating ill, sick, keeping people well, no matter how many chronic illnesses they have. But keeping them well during this time is so important. So don't underestimate everybody's role in that. That's very important. So social distancing, really kind of want to reiterate that again, like everybody else, because at this point, that is the number one thing that we have to really, really concentrate on to help prevent the spread. And so the best way I know to do this is not so much the containers, but the old-fashioned, when I was in gym class and they said, okay, everybody line up and put your arms out. You put your arms out, there you go. The other person puts their arms out, there's your 6 foot right there. Make it really simple. So now extrapolate that in your head. Okay, this doesn't just mean I went to Walmart and I got my arms out and I'm getting my apples. Okay, everybody, this is my 6 foot space. You have to go home and do the same thing. You just went out in public. So, people who get upset about the decision makers, remember, you are the decision maker for your household. Number one, you're the decision maker for you. And then number two, you're the decision maker for your household. So if you want to get behind the recommendations and in your household really educate your family what it means to be 6 foot apart, hallelujah, that is fantastic. You are part of the solution. But if you choose not to accept that, if you choose to whine about it, if you choose to still say, I don't understand why we're doing this, then I hate to say it, is you're part of the problem. We need more people as part of the solution than part of the problem. So it happens in your family. Now you're going to laugh at me when I tell you this next, okay? We all laugh in the medical profession every time something like this happens, a big old blizzard, something like that, and what happens 9 months later? OBGYN, babies start being born a lot more than usual. Can't have a baby 6 foot apart, okay? So we have to think about how we choose to recreate and help with our anxiety. But that's how important it is. So we can all be home laughing. You can go ahead and laugh at me, okay? But there's some truth to that. The other day, 2 weeks ago, I was coming home and I was driving by East High, and what did I see out there? It was a field full of young men out there playing football. Probably 25, 30 people playing football. There's your social distancing not working. That's not working. There's a lot of contact there. Now, this is what I task you to do. We definitely need activity, okay? So I task you to find a sport. This is a new one. And if you come up with a good one, I swear to God, in a couple decades, it's going to be in the Olympics. So the task is find the sport that you are no more than 10 people, that you are always 6 foot apart, and find that competition. That's what we need to be doing right now. Everything needs to be creative. It is so in my brain now. I made fun of myself when I went to Walmart. I'm always making and people probably think I'm crazy because I'm laughing going down the aisle, making fun of myself. So I walking down the aisle and I am going to look at the food I want, and I'm 6 foot away from everything. I am 6 foot away from the shelf grabbing the can. This is how I'm grabbing my can 6 foot away. So when you finally get in your head, I get it. Now the other thing is, when you get into the checkout line, this is really important because this is the other thing I'm hearing. We are getting phone call after phone call of people who work in that industry who are very, very afraid. Give me a work note. I want off. I don't want to work. I'm afraid about this. And not only in that industry, I'm getting it in the healthcare industry too. What was my favorite phrase within the past week? I didn't sign up for this. Number one, nobody signed up for this, okay? It is life. this is happening, we accept it, and we choose how to accept this challenge. And that to me is the most important, okay? We ask the military all the time. People sign up in the military, and this is where I gain my strength. People sign up in the military, and we ask them, please protect our liberties. Go out there and fight for our liberties, okay? So I am whining that I have to self-isolate in my house. Imagine the guy who has to sit in the hole out in the middle of nowhere day after day, eating the little MREs, okay? Doesn't matter what the weather is. That's what our military does. They're probably laughing at us, whining about what we have to do. So we've asked them to protect our liberties. Now it's our turn. It's all of our turn. Now it's us leading this march, and especially in the healthcare industry. We didn't ask for it, but we have it. And we have to suck it up. We have to take a deep breath, and we have to do it. If we all do it, we will get through this, and this too shall pass, but we have to all work together. Very important. Hats off to the people in the healthcare industry. Acknowledge that this is anxiety provoking. The other thing I told somebody the other day, this is how I feel. It's, every day we're listening to this. You watch people checking their phone, wonder what the numbers are. Ooh, let me see how Italy's doing. Let me see how New York's doing. Oh, I was going to New Orleans this weekend. Let me see how they're doing now. Thank God I didn't go there. So we're all looking at numbers, and we're waiting for the peak. We're waiting for the influx. Because we're seeing what's happening in New York, okay? So New York has been through, it's like a roller coaster. We're at the tick, 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 where you're going up, getting a little closer, got that little pit in your stomach. Oh my gosh, this is about to come. We're on the tick, tick up. We're waiting for okay, now we're going down. We have to go through this. And it's heck going through this, and especially in the healthcare industry. And I cannot emphasize that enough. When it goes down and you have to pull yourself through that, you have to pull from within your heart and pull as much as you can to get to the other side and to help your counterparts get to the other side. And so that's what we're gearing up to do. But the more in our community people do the social distancing and really adhere to that, the less it is on our medical profession. Okay, the more we social distance in our Walmarts or our Targets or where we go for that, again, the more it helps us. So we have to work. People have to step up and do it. We have to have food to survive. We have to have those truckers coming and going. So everybody's got to step up to the plate one way or another and help us get through this. So strongly, again, urge the social distancing. The last thing I just want to point out, because this is another question I get several, where I think people misunderstand when we really talk about the hand washing and how this virus is spread. I've had a lot of people really feel like when they're talking about, I touched this after somebody else, and sometimes I think they think the virus seeps through their hands, and that's how they get sick. It's not spread that way. So it's really important. And I'm listening to my patients who are cashiers, who are afraid of handling the money. I'm touching this money, I'm going to get it. So it's not the touching of the money when this gets on your hand and it's just going to seep in there, okay? Viruses love moisture. So there's 3 ways that we inoculate ourselves, that we cause ourselves to get sick once we get something on our hands. We either touch our eyes, we touch our nose, so leave the booger alone. I'm going to just be out straight for you. Don't go digging. Leave it alone. And then we put our hands in our mouth. And so right now, be careful with finger foods, okay? Use that fork. I'll be the first to admit, I just love to grub. I'm a chicken wing person. So, all of a sudden, it's like I got to use the fork because finger foods right now are probably not the best thing to eat. Because anytime that finger gets in your mouth, you have the potential to inoculate yourself. But what do you do before you eat? Wash your hands. What do you do after you eat? Wash your hands. What do you do when you come into the house after you've been shopping? Wash your hands. So the take-home message is wash your hands so you don't accidentally put that virus into your mouth, nose, or eyes. So I just wanted to clarify that too, because that's a lot of the questions that I see coming through. Thank you.
Perfect. So now I don't have to talk about intimacy. I don't have to talk about facial touching or boogers. I don't have to talk about social distancing or social engagements. That's covered all the things that I needed to make sure that we touched upon. So thank you, Dr. Duclos. That concludes the briefing for today pursuant to your questions. Yes, ma'am.
Can you tell me about the latest on a PPE shipment forthcoming?
So the latest forecast was ran up 2 days ago, and we have been confirmed and accepted, and I believe tomorrow we are accepting the drop.
Do you know how much it will be or when it will come?
It will be a sizable shipment. However, we're assuming it will be a sizable shipment. However, I think primarily it's going to the hospitals.
Has there been any issues with those shipments? I know Illinois, I had a report that about 100,000 roughly were the surgical masks and not the N95 like we're looking for.
Our last shipment was a little bit of both. Our first shipment was a little bit of both. The biggest issue is just it's not enough. You know, we ask for X and we get Y, or X minus 1,000 or whatever. But that is par for the course. It's what we expect. So.
I wanted to ask the hospitals about their current PPE supplies.
Our present PPE supplies are adequate for the cases we have on hand at this time. If we were to get a surge, we'll be pushed somewhat, but again, that's part of the reason even to have the respiratory clinic. It's to save PPE. If we're testing, we'll be in PPE. That person will be in PPE all day. Part of the reason if we do get a surge, to have a COVID floor, that the individuals on that floor will be in PPE all day, taking care of those patients. So at this time, we're doing reasonably well.
Do you have an amount of days out when you would run out, like other hospitals have mentioned across the country?
At this time, with our present need, we are pretty well set for several weeks out, but a surge is going to change that very quickly.
Same question to you.
Sure.
I think similarly, we recognize that right now we have adequate supply to meet our needs. The thing that we are most lacking at UnityPoint Health right now is actually the gowns. So that's something that we are looking to get more of. So we're working with our system to make sure that we have adequate supply. Right now we do have adequate supply of everything else as well. One thing that we are going to be getting we started getting is face shields. So things that we can wear to really protect some of our protective equipment. You know, you can reuse those N95 masks if you can keep them clean. So we have face shields that are going to be able to protect those masks, keep them clean so that we can reuse them and repurpose them.
Where have you been getting those from? The strategic stockpile or other private businesses?
I think that there's several different venues for getting that. So, and we've even had people locally that have been interested in trying to supply us with that. So
face shields
Face
includes fabric masks as well as maybe a plastic mask?
no, this is a plastic shield to protect from getting soiled and so forth.
Excuse me if you already answered this, but with the tent where people would be triaged if we believe that they might be a COVID-19 case, is that only for people with mild symptoms? If someone has a severe shortness of breath, has an underlying health condition, would they still go to that tent? Would they go to the ER? Would they be transferred to hospital if they present those symptoms in the tent?
Well, the people that will receive all of their care in the tent are people that have respiratory symptoms, that have mild respiratory symptoms. So they can get all their care there, get their testing there. But anybody that has more significant severity of the disease will get put inside and where they can have a thorough evaluation in the hospital setting.
How would we isolate someone in the hospital right now? If a patient were to come to the tent, be identified as COVID-19, how would we isolate them within Allen? I know there's not a whole lot of people in there right now because of various closures and suspensions, but do we have a set corner where we're like, okay, this is where we anticipate those patients to go from that surge?
Yes, right now we have one dedicated unit that is only for respiratory patients. So, and we can flex that as the demand arises. If we need to open up other units or make them dedicated respiratory units, we can do that as well. But for right now, we have one dedicated that would have 25 beds aside specifically to it. But we can flex that as we need to.
Is that part of the ICU or is it separate right now?
That's separate. So we will have ICU patients, and we are basically, we're going to have our regular ICU and then also our PACU, our post anesthesia unit where we can put patients as well. And I think that our plan is to try to keep COVID-19 patients or respiratory patients as separate from other people, like patients that have had cardiac surgery or something like that. We want to keep them separated as much as we can, clearly. So we will have the 12 ICU beds. The PACU can put another 14 or so patients in there, all with ventilators as needed. But then the other dedicated respiratory care unit is separate, and that would be for more mild disease, but disease warranting hospital admission.
Has MercyOne implemented similar kind of, a dedicated unit, things like that?
We have not implemented that at this time, but as our surge moves forward, we have stage 1, 2, and 3 that get more intense as we move forward.
And you had said that your ICU beds are going to go up about 200%. Can you quantify that in terms of numbers?
We would be able to go from our present 12 to 38.
And what is the number of current cases at either hospital system?
We're not giving that out. We're trying to protect those patients and their families for HIPAA reasons.
Is that currently the same?
Yep.
Now that there's community spread, and I'm not sure who can answer this, does that open up testing?
As of right now, the testing criteria is still the same from the Iowa Department of Public Health, so that hasn't changed yet. And we haven't received any guidelines or updates of that change.
Are we, now that we know community spread is happening, once the case has been identified, are we changing any resources into the disease investigation? Because before we were looking to see who they came in contact with, if they'd spread it. Has that changed whatsoever?
No, we still continue to do the case follow-up and investigations.
Now, all 7 cases, are they still considered active, or do we have any that are now switched over to recovered as the state tracks it?
Most of them are not active.
Not active. Okay, so most of the cases have recovered, no longer suffering symptoms.
Mm-hmm.
Okay.
Yes.
Do you have an exact number off the top of your head, or?
Do we have an exact number?
Due to the small number right now, we would not release that.
Okay. So most would probably not be correct if there's only a small number.
The statement is as the statement
Yes.
was.
Most is fine.
But it's not if there's only a couple people correct, because if we have 7 and if we say most of them are recovered, it's probably
Could be 4.
4.
We wouldn't just, but it's just most.
Okay.
Yeah.
So for a person who is not diagnosed yet, tell me how moderate changed the game, if at all, in terms of what you're asking from our residents.
So at this moment, I mean, we know that you can have the virus and be asymptomatic. And so that is why we're asking people to stay at home, self-isolate, especially if you have symptoms. There's, again, no vaccine, there's no cure. We need people to stay at home, and the hospitals will make sure to follow the testing criteria needed, but we've asked people to continue to call their healthcare provider if they have respiratory illness symptoms, and they will determine whether a test is needed or not.
Does that change from the previous guidance from yesterday's meeting?
No.
I'll build on that just a minute.
Yeah.
So every day at 1 o'clock, I lead a planning session with between 40 and 50 community partners. They're all on the internet participating electronically, and there's maybe 10 that sit in the Emergency Operations Center and participate that way as well. And this issue came up, this question came up. Now that we recognize that we've reached this next plateau, what now? And so we rely heavily on health, on the health department and Josh. And one of the things Josh said was to this entire group was, folks, we've been kind of practicing our messaging for this piece all along. And I don't know if that's simply because we recognize human nature and we want people to hear that message for the reality that it is, or if it's important for us to be one step ahead of the virus, so to speak, which if you look at our numbers, maybe we've been there and we've experienced that luxury thus far. But to date, until today, we kind of felt that way, that, even at 6 or 7 detected cases in Glascock County, we felt like we were a little ahead of the game. Today, now that we have identified community spread, one of the comments on that planning meeting was, well, maybe our message has a little more punch now. When you see 30 to 40 kids playing football at the practice stadium, or you see, a pickup game of basketball with 20 kids at the park, maybe now this message becomes a little more clear that that consideration that it won't happen to me becomes a little more obvious, that, oh yeah, this is a non-discriminatory disease or a non-discriminatory virus that will get everyone. And so maybe our message now, even though it hasn't necessarily changed, it's got a little more emphatic today. And so hopefully that's, with your help, that's the punch that we have with this change of landscape just a little bit today.
I want to go back for just a second, because I know Nafissa said we haven't received any criteria or change in guidance from the state as to adjusting our criteria for testing. I wanted to do a two-pronged question, if we had any idea as to when we might receive that updated guidance now that we have identified community spread, and then also if that criteria is still in place and this person is identified as community spread, how did they manage to get tested? If they didn't meet because it sounds like they didn't meet that criteria.
So the person could have an underlying condition. You don't know what people have that meets the criteria, right? So I think anybody that fits the criteria, the healthcare providers will do their best to test them. Secondly, we've seen community spread occurring in other areas in Iowa, and those testing guidelines haven't changed. So I don't know when IDPH would update those guidelines.
So just to reiterate, criteria is underlying conditions, travel, possible exposure. Those are the three.
So under underlying conditions, individuals who have been hospitalized as well and who are 60 years of age, I think. Yes. Sorry, I have the testing criteria.
It's just been a minute since we've talked about it, so I just wanted to get that reiterated.
Yeah, so the same testing, the testing criteria that was released on March 25th, those haven't changed. Mm-hmm.
So we're a couple of weeks away from the peak, everybody's been saying. I wanted to talk, since Sharon mentioned that Peoples doesn't have any ICU beds, but is really trying to help those people who maybe have more mild symptoms. Is there a worst case scenario where you start funneling people that are more mild symptoms to Peoples, for example, and maybe the more severe cases would go to the places that have ICU beds or anything like that?
No, not at the moment.
Not necessarily. That's why the Ridgeway for them, the Ridgeway place for us is in place, because those are for the mild symptoms also through the community.
Our biggest help is taking care of our 19,000 patients. Boy, if we can keep them healthy and out of the emergency room, that's our spot in the world.
Any other questions? All right, so as we put out yesterday and as we notified you this morning via press release, tomorrow there will be no briefing. Thankfully, we had community spread before we decided to switch the system a little bit on you. So no press briefing tomorrow, and we'll be back on Thursday. On Thursday, we do intend to discuss kind of a growing issue and a hot topic with regard to business, helping slow the spread in businesses, large business leaders within the Cedar Valley. We intend to have representatives with us to talk about essential, non-essential, some of those terminologies, and help wrap our brain around why certain people have to keep going to work and other people get to sit at home. We're going to talk a little bit about best business practices for those people that have to continue to work because their businesses are considered essential. And then we're going to talk a little bit about some of the I hesitate to call it enforcement, but some of the protocols that we are utilizing to help us socially referee some of those considerations with regard to helping us with virus control on some of those businesses that may not be quite as essential as they think they are. So we'll talk a little bit more about that on Thursday. Pursuant to any further questions, that concludes the briefing for today. Thank you, folks.